CMH was founded in 1982 as a public hospital district with the vision of taking care of the people in a rural community north of Springfield. It's grown into a comprehensive healthcare system. We care for 8 counties around Polk County. We serve a population of about 120,000 people, many of which have insurances, Medicare, Medicaid, and because of various funding opportunities, we're able to continue to provide for them when they otherwise might not have access to health care. CMH's mission is to provide compassionate care for all generations, and that really means that we care for everyone regardless of their background or their ability to pay. We do that through our exceptional healthcare team and our leading physicians. Our vision statement is to be the first choice for healthcare by delivering the safest, highest quality, and best experience for the communities we serve. In order to do that, it's really important that our patients have access to not only their treatment for care, but for their medications. And the 340B program has really provided us the ability to provide that care. Also, it's given access for all of our community to the medications that they need.
I'm Tim Walters, Director of Reimbursement at Citizens Memorial Hospital in Bolivar. In my role at CMH, I oversee reporting and reimbursement for various government programs we participate in, primarily Medicare, Medicaid, and 340B. At CMH, 78% of our patients are covered by Medicare, Medicaid, or they're uninsured, and we lose money treating these patients, primarily due to inadequate payment rates from the Medicare and Medicaid programs. As an example for this, inflation has been running 6 to 8% per year for the past 3 years during the pandemic, while Medicare and Medicaid have only been increasing our payment rates by 2 to 3% per year. Thus, there's a widening gap between the cost of care and what we're getting paid for that care. In addition, we provided over $5 million of uncompensated care last year to uninsured patients in our service area. The 340B program has helped bridge the gap between cost and payments for the services we provide to our patients. 340B is a federal drug program that requires manufacturers to offer discounts to covered entities that meet certain eligibility criteria. For hospitals, the main criteria is that we demonstrate that a large percentage of our patient population is covered by Medicaid. 340B does not cost the government anything to operate, and the discounts we receive are a tiny share of the huge profit margins that manufacturers earn each year. But those discounts are vital to rural hospitals like CMH. In addition to operating the program at the hospital level, we've also used 340B to develop a network of pharmacies under contract in the area to provide prescriptions to our patients. An additional part of that contract pharmacy program is that we offer discounts to the patients to help them make their prescriptions more affordable.
My name is Dr. Shelley Mentz. I am a physician OB/GYN at Citizens Memorial Hospital in Bolivar, Missouri. I have a passion for rural health. I feel strongly that we need to be serving rural counties with better health care. You shouldn't have to live in a major metropolitan center and go to a tertiary care facility to get excellent care. We do about 500 to 600 deliveries here a year at CMH. We diagnose cancers here. We take care of high-risk patients here. We are like the front door for how people get into healthcare in a lot of ways. I feel that our population as a whole, there's a lot of poverty in Southwest Missouri. There's a lot of patients who are the working poor, people who have jobs who don't provide insurance, they're self-employed, don't have insurance, or have insurance that they can't afford deductibles. And so we have, struggled at times financially and really have a limited margin because of the reimbursements that we get from our Medicaid and Medicare and insurance payers and our payer mix. My efforts here at CMH have also involved being on the Hospital Foundation Board for the last 13 years. Citizens Memorial Foundation is separate from the hospital board in that it is involved with other services that our organization provides, including skilled nursing home facilities and managing the properties that the clinics and other facilities operate in. through that, I can see that the margin is so thin. It is a struggle for rural healthcare to survive. And I'm deeply alarmed with the changes that may happen to 340B. It's hard to imagine how we can continue to survive if 340B were to completely go away, and we have to have some assistance.
I serve as Director of Population Health at Citizens Memorial Hospital, and really within that role, I stand in the gap and bridge what resources we have available for taking care of patients and our actual care of patients. So what I mean by that is through the constraints of how healthcare is funded, we have certain dollars allocated for billable services. The things that aren't funded are those to which our legislators or payers determine are nice to have and not necessarily must-haves. But on the flip side, for our patients, those nice-to-haves are the must-haves. So we have to figure out how to utilize those funding mechanisms and getting really creative and truly meeting the patient needs that matter, not just matter in outcomes for that patient, but matter to the patient themselves. So an example of that is CMH's dedication for resources for acute care management in the hospital. Acute care management are nurse care managers that partner with our admitted patients from admission to discharge, and they help them navigate through the complexity of healthcare. 340B has allowed us to that cost savings. We've been able to get creative and dedicate in funding the resources that truly matter for patients, that truly improve their quality of life, their quantity of life. And I'm just really thankful for those resources, because in this position for hospital and you know, those that work in the hospital, they were called because we want to help people. We love people, we care for them. And just like doing this in your own home, you kind of got to get scrappy sometimes and figure out what dollars come in and how do I meet the needs of my family and my children. We do that in healthcare too. So 340B and these opportunities for dollars for improved quality or meeting access barriers to healthcare or getting real and honest about the barriers our patients face with either lower socioeconomic status, transportation, their living condition, their education, their literacy, the family dynamics to which they grew up. It allows us to change lives. And I know that those don't always funnel through on an accounting sheet and paint that story, but without that dedication of resources, we miss the whole point of healthcare. So I'm really appreciative of that resource in particular, because it's been a big game changer for the way we can deliver healthcare for meeting the needs of our patients in our 8-county rural service area.
I'm the medication access specialist for the organization. I oversee the medication reconciliation process here at the hospital for patients who are admitted. And when that process identifies needs for patients affording their medications, I can help with the help of manufacturer copay assistance cards and 340B, help them get access to affordable prices on those medications they need. And then I coordinate the Meds to Beds program, so that way we can deliver those medications to the patients here at the hospital before they discharge, and we know that when they left our care, they had the medications they needed at an affordable price.
Hi, my name is Joe Dobbins. I'm an RN case manager at Citizens Memorial Hospital. A big part of my job is making sure that all of our patients have the resources that they need when they leave the hospital to manage their health successfully. One of those resources would be medications. We're often discharging patients with insulin, antihypertensives, anticoagulants, etc. And a lot of times when I'm talking to these patients, they're telling me that they spend hundreds of dollars a month on their medications. And then when we go in and tell them that they need more medications, they're very distressed and afraid that they can't afford it. The 340B program allows us to get these medications at a much cheaper price for the patients so that they can afford them, take them, and go back to their lives and jobs.
Hi, my name is Gayla Hankins. I'm the radiology director at Citizens Memorial Hospital. I'm here with our CT scanner that we were able to purchase partially using 340B funds, which have benefited our community in several different ways. We we're able just to scan quicker, we get better image quality with this, but we're also able to do additional exams. Prior to buying this scanner in December of 2020, our only option for stroke patients was a non-enhanced CT scan of the head. With this machine, with the addition of this and additional software, we were able to incorporate CT perfusion studies as well as CT angiography studies of the brain. This allows us to see the actual blood flow to the brain and the perfusion, how the blood flow is dispersed throughout the brain to make sure there's no occluded areas in the brain. By being able to do this at CMH, we don't have to transfer people for that service. They're able to stay in our community. They're able to stay and recover at home with their family and not have to have an expensive transfer to another hospital only to find out that those studies were normal and they didn't have to have that transfer. So that's been a big benefit for us and our community.
Hi, I'm Dr. Kevin Presley Dio. I'm a family physician, osteopathic family physician at CMH, Pleasant Hope Family Medical Center. I'm the medical director at this clinic, and I just want to say that the 340B medication savings program has been very helpful for a lot of our patients. Currently, some of the most expensive medications for patients are those for some life-threatening conditions such as diabetes and coronary artery disease. And with the 340B savings program, several of my patients have been able to get these type of medications with hundreds of dollars of savings, which was critical to helping them with their chronic illnesses and reducing their risk of life-threatening illnesses. One of the things I enjoy about working at CMH is the patient focus on the patient as an individual, and part of this is providing substantial cost savings to them through various programs that we have through being a rural health clinic, one of those being the 340B program, but also others such as walk-in services during a certain period of time and physical therapy and mental health care. All of those things I think are very important, and some of these things may cost a little bit more for us to do as an organization, but we feel it is our part to give back to our community to offer these services to our patients.
Last year, about this time, I had got really sick. Ended up having to have 3 surgeries for a flesh-eating virus, basically what it was. I had no insurance. So whenever I had the surgeries done and everything, I needed to get my medication because I found out also I was diabetic and I had a congestive heart failure and that. Like I said, had no insurance. So Pleasant Hope clinic down here had mentioned that we could use what they call a 340B, would help pay for our medication. The Eliquis that I was on for my AFib was going to cost me $500 out of pocket. There was no way I could afford it. And without it, I would have been in a lot of serious trouble for it. But with this program, I was able to get it for $54. And that was a major, major lifesaver to me. Plus my other medications with my diabetes, my test strips, my anything that dealt with my heart, especially the medicine. It was just so much better to have to pay a small copay than it was to have to pay a full amount that I would not be able to do, being unemployed and everything.
Hi, my name's Colby Grove. I'm a pharmacist. I own the pharmacy at Pleasant Hope and in Ash Grove. We work well with CMH. I come from a generation of 3 generations of pharmacist owners, and I've got over 11 pharmacists in my family, so I know the business pretty well and have been in it my entire life. The 340B program is wonderful for our patients here in Pleasant Hope and in Ash Grove. It allows many of them to have access to medications that they normally wouldn't have access to. It also helps fund the clinics and the providers that are in the locations. So without that, many of these patients wouldn't even have a facility to go to or a doctor to see, let alone afford their medications or drive to Springfield or Bolivar or even further away for specialty doctors. So I mean, it's a fantastic program. It allows us to have more expensive drugs on the shelf that we normally wouldn't have. Normally we'd wait until we knew the patient's insurance would cover it, then we'd order it, and sometimes that can take 2 or 3 days, whereas this lets us have immediate access to the medications for the patient as soon as they walk in the door, and they don't have to worry about the cost of it, or their insurance company needing a prior authorization that can sometimes take weeks or if not over a month. So.
Hi, I'm Scott Crouch. I'm the CEO of Ozarks Community Health Center, and today we're a federally qualified health center in 4 different counties. Today we're going to be talking about our unique partnership with Citizens Memorial Healthcare. We partnered with them about a year ago to establish a telepharmacy through Stevens Pharmacy, and this is currently located in our Urbana facility. In Urbana, there's a town size of about 500 residents with a lot of county folks surrounding that, and their access to pharmacy needs were very much restricted to wherever they could drive and get to. And with the services that we now provide through telepharmacy, we're able to provide that service and they can get their medicine the same day as they have their appointment. So this has become a great benefit to the patients of our Urbana clinic and to the entire community. They now know that they can go to our location and get pharmacy services from the partnership with CMH Stevens Pharmacy. One of the things that we're currently worried about right now is all the restrictions with the 340B companies. 340B has enabled us to be able to do a lot of things, grow our programs in a variety of ways. But the pharmacy situation in Urbana is something that I have tried to figure out for 7 years to bring those services to the community. It was only because of telepharmacy that we were able to do so. And in doing this, it's been a great benefit. We now prescribe and approximately 45 to 50 scripts a day are being filled through this telepharmacy partnership.
So the 340B program is absolutely amazing. It really truly allows us to be able to, twofold. One, give patients access to medications that maybe they couldn't afford and actually get on therapies that work extremely well that they wouldn't have been on, previous to the 340B program or without it, quite frankly. But it also helps the clinic itself be able to financially be viable and sustainable. Endeavors like this, where we're in a small area with a very limited population, there's not a huge room to grow. There's not a huge room to even be able to sustain sometimes a business like this. And a program like 340B allows us to be able to be here. We can then make it financially feasible for us to be here and serve the patients and then get them those medications that help them be healthier individuals, help them to live a better life. Without a program like 340B, I don't know how much of this rural area would actually have access to even healthcare at all, because of the financial feasibility of it is just sometimes not there. And then once we are here and we can make it financially feasible, to then be able to open up access for those individuals that financially can't afford some of the medications that are on the 340B plan. One of the customers said this morning, prior to them being here, I had to drive all the way up to Buffalo. And that's the reality for most people, is yeah, sure, they have the physician's office right here in their backyard, but once they're diagnosed and they get a prescription, they still have to drive 30 minutes to get the prescription. So being here means that they have a one-stop shop. They can come in, see their physician, get the prescription order, walk right over to the pharmacy, get the prescription done, and then head home afterwards. That does a lot. Patients who are sick can get their medications and start their therapies and get to feeling better soon, as opposed to having to wait a day or two to even be able to get to Buffalo perhaps. If you're feeling sick, you don't really feel like going there anyways, so just even the logistics of getting out there is tough. But then there's a lot of benefit as far as individuals starting their maintenance therapies. How many people do we hear get prescribed a blood pressure medication but never actually make it to the pharmacy to pick it up? And when a pharmacy is that far away, there's a feasibility there where a lot of patients never even start the therapy that their doctor intended them to start. Being right here, it's like there's no excuse. You literally walk out of your doctor's office and you walk right into the pharmacy. And the prescription is there and ready. So it's just the convenience factor there. It really makes sure that the patients that we serve are fully encompassed. They get the full healthcare experience from the moment they come in, they see their physician, they get their order, they go to the pharmacy, and they get to go home. And we know that they're taken care of.
My name is Christina Bravata. I'm the Director of Grants Management for Citizens Memorial Hospital. One of the things I love about my job is the opportunity to look for resources and funding opportunities for the underserved populations that CMH serves. One of those populations is mental health patients and patients that suffer from substance use disorder. One of the projects that I am so incredibly proud of is the addiction recovery program that I and my husband, Dr. Kurt Bravata, founded here at CMH. In 2018, there were little to no resources for substance recovery treatment, especially resources related to medication-assisted treatment. When we began our program here at CMH, we started with 15 patients. Currently, we serve almost 500 patients per month. In that population, we have a lot of patients, probably 20 to 25% of our patients that are reliant on 340B pricing in order to get access to medication that is literally saving their lives. This includes forms of naltrexone products, buprenorphine products, and other products that are meant to stabilize somebody who suffers from substance use disorder. Addiction is something that has been discussed on the national level, on the statewide level, and promoting and supporting 340B pricing is one of the most effective ways legislators can support people that are trying to find treatment and recovery with this condition.
My name is Mariah Hollabaugh, and I'm the Director of Pharmacy for Citizens Memorial Hospital and Healthcare Foundation. In my role, I oversee all pharmacy operations and 340B program compliance for our organization. The Health Services and Resources Administration has a very complex set of rules and requirements to determine 340B eligibility. At CMH, our pharmacy buyers, managers, and technicians dedicated to program compliance and managing our uninsured program go through rigorous training and complete the 340B University program through Apexis. We have a rigorous audit schedule and invite an external auditor to review our program every year. All program policies, procedures, data, and audit findings are reported to our 340B Compliance Committee quarterly. That committee consists of representation from our C-suite, billing, finance, informatics, quality, clinics, and our pharmacy team. We utilize specialized software to manage qualification filters, virtual drug inventory, and invoices. 340B has a lot of moving parts and pieces and requires constant attention and system maintenance. CMH regularly hosts meetings with our pharmacy partners to discuss program logistics, new services, and population health initiatives that will benefit mutual patients in our communities. Education is provided to frontline staff, providers, department managers, and our boards on the 340B program. CMH is committed to being a good steward of the 340B program and continues to identify unmet needs and innovative new services to reinvest 340B savings in our community and workforce.
The 340B program has been under attack for the past several years by manufacturers. They have been trying to restrict how many contract pharmacy programs we can operate. The courts so far have acknowledged that the manufacturers must offer discounts to hospitals like CMH for the prescriptions we provide. However, the courts are split on whether manufacturers can restrict how many contract pharmacy programs we can operate in our service area. And while the appeals are ongoing at the court level, the manufacturers have continued to increase their attacks on hospitals like CMH. Due to their high profit margins, manufacturers have huge lobbying budgets, and thus a resolution to this contract pharmacy issue is unlikely to be achieved at the national level. For this reason, we seek support at the state level for rural hospitals like CMH so we can continue to provide safe and effective care to our patient populations.
Now we are being faced with certain restrictions to where if we're going to get a 340B discount, we have to choose which pharmacy is best. For our current organization, if we have to choose this, we're now choosing a pharmacy in Hermitage, not the only pharmacy in Urbana. And that is strictly because we have to choose what is going to do the most good for patients. Even though this still may do the most good for our patients, overall, it's still going to restrict the access that our Urbana patients have come to know and love over the last year.
The administrative burden on the 340B program has grown significantly over the last few months as manufacturers and insurance companies demand more data or require system modifiers that in many cases are just not possible at the time the medication is dispensed.
ESP, we submit data to ESP for all of our claims for our contract pharmacies, our retail pharmacies, and there's a lot of work in auditing and pulling spreadsheets, verifying that our wholesalers have the correct pricing so we can use that 340B discounted price like we should. So it's very important that all the extra time and expenses to get that discount.
White bagging is a practice where payers require a plan-selected and often owned pharmacy to dispense clinician-administered medications and ship them to the hospital or clinic for administration. The hospital pharmacy is still responsible for coordinating the medication shipment, storage, preparation, and disposal. The hospital's only billable service is an administration fee that may or may not cover the time spent by the nurse to assess the patient and administer the medication. The white bagging model introduces multiple points of concern that can delay care and causes a lot of confusion for our patients. White bagging bypasses multiple safety systems and can introduce products that are outside our formulary. It adds to our workload and requires manual manipulation to bypass the normal billing procedures.
So when we first started here several years ago, we only had a couple of patients that were mandated by their payer source for specialty pharmacies, and that's increased now to almost 30 patients. For us, the workload, it really challenges us because we have to arrange for delivery of the medication, and we do that by speaking with the specialty pharmacy, the patient. Oftentimes the medication doesn't arrive by the patient's appointment date, so we will either have to cancel the patient's appointment, which is very inconvenient for them. It not only affects the way they feel, but they arrange their schedules around their appointments. If the medication isn't delivered appropriately, like a lot of times it goes to the wrong location, we have problems with the storage of it. So sometimes it has to be wasted because it's not been refrigerated appropriately. So that, just increases the waste and the delay of treatment for the patient.
A lot of times it's a really big deal for them to schedule an appointment with us. They have to work around sometimes work and different things, and when they have to reschedule over and over again, it's very upsetting for them. Their symptoms get worse, they feel worse afterwards if they have to wait and there's a delay, which there seems to be a lot of the time.
And a lot of times too, sometimes their treatment will change from when the medication is delivered. The provider will make some kind of change to the dosage, and that medication won't be available at that time. So then that provides another delay, and the patient has to be canceled again and rescheduled.
I think it's a big hassle for our pharmacy too, to have to keep track of medicines that are delivered from an outside source. It's something different and extra that they have to do, and I feel like it's harder for them to get the medicine in the way that they're supposed to.
Whereas we do have those medicines on hand, it's much more efficient and provides much better patient care if we're able to buy and bill from our pharmacy and supply it through us.
Much easier.
My name is Paula Shepard, and I have lupus. Lupus is an autoimmune disorder, and it attacks your skin and your kidneys and your joints and your brain. And sometimes the more severe cases are treated with chemotherapy. And so for the last few years, I've been receiving chemotherapy to remove my immune system to keep my body from attacking itself. It shows up mostly in me, in my joints. Lupus is not something that I will die from, but it'll eventually put me in a wheelchair. I'll be unable to move my feet and my knees and different joints. I have a lot of pain in my hands especially, and I don't have full function of my hands. I have been receiving infusions at Citizens Memorial Hospital for the last few years, And in the last year, a new drug came out, and my doctor, a rheumatologist, said, I think that you might have better results on this other drug, because the goal of the treatment is to send lupus into remission. It is not something that you can cure. And so we're hoping to get it into remission. And so we're trying a new drug. And what happened is that it just took a very long time, because the drug company said, well, we want you to use our pharmacy for the new drug that you're using. And so I had to go several months without treatment. And when you do that with lupus, the drug is not a switch where you turn it on and off. The drug works cumulatively. So every day that I didn't have the drug, I was going backwards. And then when I did receive the drug, then it took another 60 days to get back to where I hopefully get back to where I was before we ended the treatment. During that time, I was in a lot of pain. I had to restrict my activities. I wasn't able to go about my normal life of even having a desk job, because I wasn't able to just get up and walk across the hallway to my office on some days. The people closest to my treatment, the doctor and the hospital, know best what I need, and the insurance company has given approval for the drug. When the drug is administered locally and I can receive it locally on a schedule as it's prescribed, it gives me the opportunity to lead a normal life and to not have to worry every evening about the pain that I'm going to be in. I just can come every time exactly as prescribed on the exact day that it was ordered and get the treatment and leave feeling better.
White bagging will divert at least $480,000 from our organization this year. Our third quarter financials show this is the difference between a negative operating margin and break even for our organization. All we are asking is for the payers to allow us to provide the product at the point of care and be paid at the same rate as those specialty pharmacies. If the rate is set up front, there is no added cost to the insurance company to use our supply, and the hospital has incentive to manage our own formulary and reduce our own expenses.
And another aspect of my life, I'm on the board of pharmacy, so I see white bagging. We get tons of complaints with that. And I mean, that is a huge, huge problem in the hospitals, because we have people that are going without life-saving medications just because the PBMs didn't send it to the hospital. When the hospital has the same medication sitting on their shelf, they cannot administer that drug to help the patient. And I mean, when you know what the patient needs and you have it sitting on your shelf, that's just, I can't even fathom how we've gotten to this point, but it's because of greed and the PBMs wanting to make every dollar they can at the expense of patients, pharmacies, and hospitals.
I think that it is possible that the insurance company might be manipulating the system to provide fewer dosages and fewer infusion treatments because they save money by doing so.
I passionately want to encourage whatever help you can give rural health care these days. Our nursing homes need help, our hospitals need help, and 340B is a way that our patients need help. Our patients struggle. Driving several hours to another facility, they don't have gas money, they don't have transportation issues, they can't make easy payments and medicines. And that sometimes can be a barrier to their ability to follow through with directions from physicians because of financial concerns. 340B is a huge benefit to our patients, and we need to promote that.
Today we just look to the legislation to see if there's anything that they can do to help pull back some of these restrictions so that we're able to continue to serve our patients to the best of our abilities.
When you can make a difference for an individual, you can impact a family With the family, you can impact a community, and with the community impact, we can impact this state and start to turn around some of the devastating diseases that we have seen infiltrate our communities. If you want to say you represent the underserved populations that we hear, the boots on the ground, the people in the hospitals and clinics and community-based organizations see and treat every day, then please support the 340B pricing program that is under attack. There are people that rely on it every day, not for medications that aren't needed, but medications that are necessary for them to live full, functional, healthy lives.
340B is so much more than a drug discount for our patients. At CMH, we rely on the program to provide the safest, highest quality, and best experience we can offer. We need legislative support to prevent white bagging and other payer-mandated strategies that reduce access to 340B medications, decrease payments to 340B pharmacies, and divert 340B savings out of the communities we serve.
It's awesome to be able to see those patients come in and know that without a program like 340B, that interaction, that healthcare that we could provide to that patient, the life that they're going to get to live because they now have access to something that wasn't going to be there prior is amazing. I mean, that's why you go to pharmacy school, that's why you go to medical school, it's why we're all doing the healthcare right now as it is to be able to have those kinds of interactions and those kind of impacts on people's lives that you don't get to see anywhere else. That's why we do it.
Safety net hospitals in Missouri need action now. Help us put a stop to discriminatory practices before they erode a program that was put into place to keep our doors open so that we can care for residents in rural and vulnerable communities across the state.